Hi, my name is Nathaly. Come do an MSK ultrasound with me. First, you want to make sure your room is set up with the proper necessities you may need during the exam, such as clean paper on the table, 1 to 2 filled and preferably warm bottles of gel, gloves, and sanitizer for sanitary purposes for both parties. As I prep for my patient to come in, I want to make sure to state how important it is for you to greet your patient as well as to review and confirm the exam you are performing on your patient before starting. You also want to let them know in what position you want them for the exam. In this case, I will have them sit up with their pants rolled up above their kneecap. With a linear transducer, we want to make sure your depth, brightness, and other settings are properly chosen before starting the ultrasound, making sure that the transducer spacer is facing up when holding it in the sagittal position. An MSK ultrasound is anything related to any muscles, joints, tendons, ligaments, nerves, and cartilage. I tend to sweep and rock my probe when trying to capture the best image. The femur and tibia are across from each other and can be used as what we call a landmark. Here is the meniscus, which is in between the femur and tibia. The hyperechoic lining represents bones and ligaments, and the anechoic structures showcase muscles and tendons. This is what we call an injection entry. And on the other side, you will also find an injection entry. Once the exam comes to an end, you want to make sure you clean up your patient, transducer, and room with the proper sanitation tools. Also, don't forget to answer any questions your patient may have after to the best of your legal ability before they exit the room. Thank you.